We see this. We hear about earthquakes in the Philippines. We hear about the bushfires in Australia taking up almost a quarter or a third of the country. We hear about what's happening in Iran with the U.S. and Canada and all those things going on. We also hear about coronavirus in China, and there's a big scare going on there. And we're not exempt. In Nigeria, of course, we're dealing with Lassa fever. And if you remember, when we had the DG of NCDC, the National Centers for Disease Control, Dr. Ehekwezu, he came and talked about what they are doing and what the government is doing to try and keep this under control. And their ministry and the Ministry of Health is doing a really, really good job where that's concerned. Now, we have today no other than the Minister of Health himself to come and address the public and to help enlighten us on what's going on with where Lassa fever is concerned. And the bottom line is that you have no need to fear if you do the right things. So we will be right back. Don't go away. Okay, welcome back. Lassa fever. And we're also going to talk about coronavirus as well. But on me on the show today is none other than the Honorable Minister of Health in Nigeria, Dr. Osage Ehanire. Yeah, welcome, sir.
Good morning.
Good morning, sir. It's an honor to have you on the.
Thank you for inviting me.
Appreciate you making the time to do it, sir. So, Lassa fever, we're looking at over 40 cases, fatalities, deaths so far, and over how many people are we suspecting have Lassa fever right now?
About 256 as of last night.
256.
And 40 fatalities, 19 states.
Well, that should be of some concern to the ministry.
It is of great concern, and that is why this opportunity to have some public messaging is very welcome, because the focus, like in any other situation, is prevention.
Yes.
We want to talk more about prevention, messaging the population about what to do to avoid these high incidents.
Absolutely. And there are some focal areas that your ministry is particularly interested in. So, I know we've seen cases in all 19 states. Mm-hmm. I'm sorry, in 19 states out of the 36. But are there areas that you're particularly concerned about and want to really tell the healthcare professionals and healthcare workers and the people living there to take special caution to about?
Well, there are areas where the endemicity seems to be very high, where we usually have the highest cases, the highest incidents. Those are Ondo, Edo, and Ebonyi. The reasons are not very clear yet. Mm. But in the middle range come Taraba, Bauchi, and Plateau, and then sporadic occurrences in the other states.
Yeah, because Lassa fever is, traditionally we think of Lassa fever as something that happens in dry, dusty areas during the dry season, and the states that you've mentioned are not anything but the dry parts of Nigeria.
Well, they're not the dry parts, but it's a dry season. That is a high season for this kind of disease. The rainy season usually is extremely low. The connection with the rat, the multi-mammal rat, is still very much at the forefront. And it is believed that at this time of year, the risk of their leaving the bush and entering a house, houses is high, mm-hmm. and also going to look for food where humans store food. And during that occasion, they deposit feces and urine, fecal matter, which contains a virus.
So that brings us to the question of environmental and personal hygiene, does it not?
Extremely environmental, personal, and above all, food hygiene. The rats are looking for food, and if they get at your food, they leave their footprints and urine and the feces behind. You unknowingly will partake or consume of it, and then that is the chain of infection.
So we're also talking about people who have, culturally, many people just kind of like dry their food outside. Are we talking about that as well, or just stored food?
That is a very, very staunch index, suspicion. The food dried outside, which people leave outside on the street or on the road, or it's highly at risk. Mm-hmm. So we do recommend that the food is covered in a wire mesh, or you can, in rural areas, also put it on the roof. It's less likely to be invaded if it's on the roof or somewhere more secure, where you are more certain that rodents will not get at it once you turn your back. Mm-hmm. Because at this time of year, they're looking for food everywhere. They find it, and behind your back, they go and take a bit of your food and leave a virus behind.
So we need to be particularly concerned where it comes to hygiene and not being careless. I think we tend to be a little careless as
Yes, I
Nigerians,
think we are presumptive with health, and I think that there's need for strong social and behavior change communication in this respect. So we change our ways of doing things and don't give vectors much of a chance to get at us.
At us, yes, definitely. Let's take attention to the NCDC and what the DG has been doing in well, under your direction, of course, sir. We had Dr. Hekwazu on, and he also, some time back, and he also came to talk about the importance of awareness, education, but also the importance of what you just said, being presumptive. We have a fever, we think automatically it's malaria rather than testing. And I think from what we've seen, we've heard a lot of good report about the NCDC and what they're doing to deal with that mentality. Testing centers, you mentioned the rapid response team that has been delegated to about how many states now?
At least 5 states.
About 5 states. And what exactly is their role?
Well, there are states where you have a sort of endemicity, which I mentioned now, Ondo, Edo, and Ebonyi, where there is a lot more awareness about Lassa fever. There is a higher index of suspicion, even among the health workers, the doctors. So when they see cases of fever and try to treat for malaria and there is no response in a short time, their mind already goes to Lassa. So they are quicker on the draw than those other doctors in states where they don't see much of Lassa fever. And it is in those states that we have seen many of the casualties that we have seen recently. In fact, the case fatality rate for Lassa, which a couple of years ago was about 30%, has dropped to 15%, which means that instead of losing 30% of patients nowadays with improved treatment and faster treatment, we lose 15%.
Oh, fantastic.
We hope to bring that figure to zero. That is the plan.
Yes.
But again, use the opportunity to alert doctors and other healthcare givers in all parts of this country to have a higher index of suspicion. If you see a case of a fever, we are treating with malaria medicine and Panadol, and you don't get a response in a short time, or the symptoms appear to be getting worse, go to a healthcare facility immediately. And the doctors also who see these cases should immediately let their mind go on to the possibility of testing for Lassa fever.
And I think that brings up an important point, because there was a recent report about 4 or 5 healthcare workers in Kano actually contracting the disease. As a result, and some say because they didn't take these precautions, they didn't have this high index of suspicion, they didn't partake of the protective control measures that have been put in place by the NCDC and the Ministry of Health.
Yes, that's true. Kano is one of those states that had very low incidence of Lassa fever, so a case did come in. It was pregnancy and bleeding during term pregnancy, and the doctors performed the cesarean section quite with all the best intentions, not thinking of anything. And it turned out that this lady actually had Lassa fever, and unfortunately the healthcare workers were infected that way. I was in Kano over the weekend to see the situation myself and speak to the Aminu Kano Teaching Hospital where it happened, and all the measures for prevention have been taken. They lost 2 staff, and 2 others who are recovering in treatment, and about 213 who are being monitored.
213?
Yes, monitored. Those are the contacts, those who they were in contact with during the period, just watching that they don't develop symptoms. That is a routine practice, that if you have an index case, you monitor all the contacts in the family in case they may have contracted it, and watch them for a period of time, like 2-3 weeks, and after that you relax your guard.
Is there a way, let's say a healthcare professional in Gombe, for instance, has this high index of suspicion, are the testing kits readily available?
The testing kits, the testing kit is a PCR laboratory. We have 5 of them functional now, and doing very well. Awo was the last one to get a very functional PCR machine. And the protocol now is to send the sample as fast as possible to Abuja or to the nearest testing center, where the test will be given to you within a few hours. We have very rapid ways of doing these tests. The laboratories are open around the clock, so they can do the tests as quickly as possible, so you get your result rapidly. That's one of the great improvements at the Nigeria Center for Disease Control. So you can immediately start treatment, or if you can't treat, immediately put the patient in an ambulance and convey them to a treatment center.
At this point, the Honorable Minister and I will have to take a break. We've just been informed by the directors. We'll be right back after this break. Okay, welcome back. I'm here with the Honorable Minister of Health, and we are talking about the Lassa fever outbreak in Nigeria and what the ministry is doing in collaboration with partners and the agencies like the NCDC to keep it under control, but also, more importantly, to educate you, the Nigerian citizen, on what you need to do to keep yourself safe, to keep your family safe. So thank you again for being on the show with us today, sir. We've talked about identification. We've talked about some of the states that are involved. Let's talk about treatment. Once a person is suspected to have the disease, Lassa fever, what are the things in place? How are they being treated now?
Well, we have quite a few treatment centers, and we have, luckily, it's one of those diseases for which we have treatment, something called ribavirin, and it is given to those who are already infected early enough, and we have the tablets given to those who are highly suspected of being infected. But like with all ailments, the time we start the treatment is of essence. So we do encourage people who feel they have an ailment like that to go early enough to the hospital so that they can be assessed and diagnosed, and treatment can start early. Chances of survival are higher the earlier the treatment starts.
Of course.
Yes.
And is there something that the state governments can do to help facilitate this?
Yes, the state government can help a lot. We like better relationship with the state departments of public health, particularly with case finding and reporting. We also solicit assistance of state governments in logistics. The Ministry of Health and the NCDC have a mechanism for getting samples from state capitals to testing centers. But the challenge of getting samples from local governments to the state capitals is what we need support for from states, from state governors, because that is a challenge, bringing blood sample from places to the state capital where they are picked up by NCDC. NCDC doesn't have the resources to go into every local government in the country. But we can do that from 36 states and Federal Capital Territory. I understand that the challenge is particularly high for those very large states like Niger and Taraba with large area.
Right,
so I do believe that here particular assistance is needed with regard to logistics, the use of motorcycles or whatever. But these samples are specially packaged, and they need to be sent early enough and packaged properly to be sent to the laboratories.
And of course you've reached out to the governors, and there's cooperation is high?
Yes, the cooperation is solicited at all opportunities. When we have the opportunity to brief governors at the Governors Forum, also when there is a meeting of National Economic Council, we do touch on subjects that are of common interest, particularly where we need a better synergy between federal and state governments, and at state level between the state and local governments.
Right. Right, and we hope there'll be more and more synergy, especially in this period. I've been keeping tabs with the NCDC too, because I've been really impressed with the control, the structure, and how they've really taken this whole idea of infectious disease to heart to really address it.
Yes, the NCDC deals with diseases of public health interest, public health security. And we also, when a situation is dire, also report to the National Security Advisor, because these are things that come out of the sudden, and they can really have quite a lot of effect on the economy if you are not fast enough to curtail those such outbreaks.
Absolutely.
So the cooperation of general population is very important. The state authorities and local governments, and above all, the messaging mechanism. We intend to open a dialogue with the Ministry of Information to improve messaging,
right.
Particularly with regard to those behavior patterns that tend to provide more chance for disease spreading,
right.
So that we can have a more preventive measure. Our focus on prevention is cheaper than cure.
Absolutely.
And we also wish to have, of course, the capacity to respond to any disease case management.
Absolutely.
Yes.
Speaking about infectious disease, sir, coronavirus is becoming a growing concern. Should we be concerned about it in Nigeria and West Africa?
Well, I think that all countries need to be concerned, and as a matter of fact, all countries are concerned. We are following very closely the development of the coronavirus epidemic, and taking measures here in Nigeria to ensure that Nigerians are safe. We are looking at what other countries are doing. It's a good example that China itself is putting certain cities under restriction to limit the possibility of people carrying this disease outside,
right.
Which is probably quite helpful.
Yes.
And also we are here looking at airports as probably the only primary channel of entry into our country. We are not looking at, I mean, we are aware of land borders, but that is not so likely, but the air borders. So we are looking at screening all passengers who come in more intensively, and we have thermal cameras installed at the international airports, check all passengers passing through, and anyone who is suspected is interviewed very politely, and we take the travel history where he has been to, especially if he's coming from the Orient.
Right.
We want to know how long he has been there and how long he's been traveling, so that if there's any suspicion, we know what to do.
I think that's really, really important. So any other things that you really want us to pass across to the general public?
Very important is not to panic, not to be afraid, to listen to public announcements, and also to improve personal hygiene, domestic hygiene, and also food hygiene with regard to both the Lassa and coronavirus. And also not to resist healthcare workers, because there are stories of some citizens being hostile when they are being advised on health behavior, and particularly those who are stuck to certain behavior patterns. And but there need to be some social and behavior change in with regard to how we manage food and manage our own environment, sanitation, hand washing, and so on. Those are extremely important, particularly also again looking at if you have a cold or you have a cough, you try to restrict yourself, stay within your room so that you don't spread to your own family, your children, and your loved ones. And use a handkerchief or tissue when you have to cough or sneeze, and discard it, not to cough directly into the open or sneeze directly into the open. And avoid crowded places, and also report immediately if you feel that you are getting very unwell.
Absolutely. And this, a lot of it has to do with common sense approaches to health and hygiene, doesn't it?
Well, it has, but common sense, as we know, is not that common. So we really do need advisories,
yes,
and to let people know that you apart from what you have been told here and there, there's still more to learn with regard to looking after yourself and looking after your family.
We also know, we talk about infectious disease a lot, but we also know black people in particular are more prone to certain conditions like hypertension, cardiovascular disease, cancers, diabetes, and we know that when I spoke with Dr. Hekwazu, they were saying that's the next step after we've taken care of the infectious diseases. But I know with the public health departments and other departments, we're already pushing towards that. Anything you would like to share with us with regards to non-communicable diseases?
Well, yeah, you are correct. In fact, we are worrying now about the increase in non-communicable diseases.
Yes.
And looking at the problems that non-communicable diseases will bring up in the future. But again, a lot of it has to do with what we eat. Our food pattern has changed over the last 40, 50 years since we have been relating with Europe and with the rest of the world. And there are certain foods that we consume in excess, which is being described as actually not very good for the health.
We dispose of, yes.
Yeah, so we are discovering, for example, that consumption of too much salt can entertain hypertension, and we should reduce salt that we take. It's also coming out clearly that excess consumption of sugar, particularly with adults, can be harmful, and that is what predisposes to diabetes. And so we are also asking for moderation and serious reduction in sugar consumption, particularly with those who are already past a certain age of 30 or 35. And so that you save yourself what might be coming. You might not see it immediately, but it comes up. And then practices of what kind of oil you use, what do you cook with. People are departing from natural palm oil and natural groundnut oil and going to other kinds of funny oils that we don't know anything about, which do to some extent have suspected to be connected with problems of sclerosis, arteriosclerosis, and cholesterol. So processed food, a lot of processed food that we are consuming,
which have a lot of salt, by the way.
Have a lot of salt and a lot of preservatives, the preservatives that allow them to keep, which you definitely consume along with the food. Now, what is the effect of these preservatives in your body? So we advocate fresh food from the farm, fresh from the field, fresh catches of fish and meat. And again, of course, looking at meat, a lot of meat that we eat coming from the poultry and perhaps even beef that has consumed quite a bit of antibiotics during when they are being raised.
Yes.
And you consume the antibiotics too. We are worrying about the antimicrobial resistance that is growing from that source.
Yes.
So all of these affect your health. And also certain behaviors that appear now and then out of nowhere. The last we heard was that some people are tenderizing their food with Panadol. They put Panadol to cook the meat, which is absolutely absurd. We don't know where that comes from, but there's suspicion that boiling Panadol can break it down into chemicals that can damage your kidney. And we have a large incidence of kidney diseases going on right now.
We do.
A lot of people who need dialysis, for some reason the kidney is damaged, and we suspect that all these crazy practices are responsible for diseases that were not so rampant before.
We've been trying to get the NAFDAC DG to come over and talk about that too. Maybe you can help out with that.
Yes, we can facilitate that. She has the responsibility to monitor what we eat and the medicines we take, and we have been talking a lot about that. We are into health promotion. The easiest way for a doctor to start looking after his patient is disease prevention and health promotion. Absolutely. So we are deeply into health promotion, disease prevention, which costs a bit but saves you a lot more.
Absolutely.
In the long run. So you reduce your disease burden.
Absolutely. Sir, it has been a great honor, and I want to say thank you again, sir, for taking the time.
And thank you for
coming to speak to us.
Thank you for inviting me.
We appreciate it, sir.
Thank you.
There you have it, folks. We have been on with the Minister of Health, Dr. Osage Ehanire, and he has given us a great amount of information to share with you. Remember, your health is in your hands. Be sure to join with us next week, and all the different times. We're on about 5-6 times a week, probably sometimes even 7 times a week. So be sure you don't miss any of our programs. God bless, and see you soon.